So first, this is a very exciting meeting, and DESTINY-Gastric04 also changed clinical practice, especially in Asian region. DESTINY-Gastric04 is a global randomized phase 3 to compare TDXT and paclitaxel plus ramucirumab for HER2-positive gastric and GG cancer, and it showed a significant and clinically meaningful improvement of overall survival improvement. A median was 14.7 months with TDXT and 11.4 months with RAMPAC, showing 3.3 months longer median survival with TDXT, and the hazard ratio was 0.70. PFS and response rate were also significantly improved, and safety profile were in line with the previous reports of this treatment. Since TDXT is now only approved as a third-line treatment, for example, in Japan and China, I believe this trial result may expand access into second line, and more patients could be treated by TDXT. And at that time, re-biopsy after previous first-line HER2-targeted therapy must be important. And also in this ASCO, we also presented the trial in progress session about the DESTINY-Gastric05, which is a combination trial to investigate chemo, especially capecitabine and pembrolizumab and TDXT, 5.4 milligram per kg, to compare current standard of care, Keynote 811. The study is just started, but I believe this DG04 study may support development in first-line setting. And today, we will have a very great presentation of the Matterhorn study as a global phase 3 at the perioperative setting, showing FLOT plus pembrolizumab improve event-free survival compared with FLOT plus placebo. Previous analysis already shows the benefit in pathological complete response rate, but benefit in EFS is very significant, and I hope it may also change the clinical practice in perioperative setting and lead to regulatory approval of this treatment. I believe this is a very important beginning of further perioperative development. Well, again, the trial compared TDXT and RAMPAC and require fresh biopsy of to test HER2 status before previous anti-HER2 therapy like trastuzumab. So in future or very near future, it is more important to test HER2 status before second-line TDXT treatment to confirm the HER2 positivity before using TDXT. So I believe this is a very important implication in clinical practice, and hopefully this trial lead regulatory approval and further reimbursement of TDXT globally. Yes, this TDXT already showed efficacy or activity in multiple studies, including DG01, DG02, DG06 in China, as well as our current DG04. All studies showed consistent efficacy, like response rate about around 40 to 50%, median PFS around 6 months. That's still not enough, and actually previous preclinical studies support the use of checkpoint inhibitor to combine with this kind of ADC agent to enhance the immunogenicity because of the activation of dendritic cell and other T cells. And DG03 as a phase 1-2 study already showed a acceptable safety profile and encouraging efficacy with TDXT in combination with capecitabine and pembrolizumab. That's why we are currently doing the phase 3 of DG05. And also in our institution, there is an investigator-initiated trial to test TDXT in combination with capecitabine and durvalumab for HER2-positive locally advanced population. So again, DG04 and the previous several trials of monotherapy TDXT support further development at combination in earlier line setting. DGO4 showed enough activity as a monotherapy in second line, but if we consider moving forward for first line, I believe the TTXT as a monotherapy may not be enough because current standard of care Keynote 811 regimen showed a very high response rate and long PFS. So based on DGO3, combination with TTXT, capecitabine, and pembrolizumab showed a very nice activity. So that is why DGO5 is ongoing. And the other investigator-initiated trial we are doing in the institution is to test additional combination with oxaliplatin. This is especially for HER2-low population because TTXT activity for HER2-low may not be enough to use it as a monotherapy. So we want to combine with a multiple chemotherapy like capecitabine and oxaliplatin. And the trial already finished the recruitment, and hopefully we will report the result in the future. And this is just a beginning of TDXT or ADC with checkpoint inhibitor combination. But there's a couple of other ADC like a claudin-targeted ADC, etc. And surely this agent is currently investigated as a combination with checkpoint inhibitor. And hopefully this multiple combination may improve outcome of gastric cancer patients.